Okay, I miss a few people here. Or, well, anyway, my name is Anders Bomstedt. I'm from Region Västergötland, Sweden. I've been working with chemicals for a long time, and I'm also chair of the board of Healthcare at Harm Europe. And Andrea asked me to say something about PVC. Now we had a heavy chemical morning, and we continue with PVC, which is heavy as well. And I'll see if I manage. First, the question: why do we use PVC? Okay, it's very useful. Fine, it's versatile. You can have it very flexible or rigid, whatever, and it's cost efficient. It's very cheap, nice, and we're used to it. It has been around for a long time, so it's there. Okay, why is PVC a problem then? It's actually a problem because it causes harms to health and environment throughout its whole life cycle. From the production, manufacturing products, when you use it, and the disposal. So PVC is actually really problematic. If we start with production, this is where it all starts. Sodium chloride, salt. You can think of this when you put salt on your breakfast egg. This is a precursor of PVC. Okay, then you think salt, that's not a problem, it's not toxic. Okay, you should not eat too much because it could harm your heart. But if we start with sodium chloride and water, it's called brine. The problem starts when you make chloride out of it. The methods for using that, this point is not working on a screen, no. There are different methods how to make chloride out of brine. And the one method is worse than another, is like levels in hell. You can see they contain mercury, asbestosis, and you have this with coal and mercury in China. The reason I show this is that depends on where the PVC is produced. Number 4 is actually the worst one, and that is in China. That's where we buy most of the PVC we buy comes from China. Okay, then we have chloride, fine. Then we put some ethylene into it, fossil products. Then you have the carbon emission problem, and this process is really energy consuming on top of it. And then we have a vinyl chloride monomer, which is really toxic and flammable. There was a terrible accident in US with a train that was derailed, and these chemicals were spread, and I think it was fire or something. So it's really catastrophe. It actually happened close to my hometown some years ago. Fortunately, the wind was blowing in the right direction. Otherwise, all these chemicals have been blown right into the city. Okay, then we have PVC, fine. But PVC is kind of useless as it is. You have to add things to it, like fillers, plasticizers, pigments, flame retardants, whatever, depending on what you're going to use it for. And then we have the PVC product. The problem is that these chemicals that are added to the PVC, they are not covalently linked to the PVC, so they evaporate. You probably experience when you have a plastic bottle or something, after some years it cracks. And if you buy a new car, if you can afford it, you can probably notice that it has a typical smell. And you can have some fast thing on the windows in the car. That's the plasticizers evaporating from the fresh PVC. Don't lick the windows. Tell your children don't do that. So it degrades, and Then the disposal, you can incinerate it, and as we heard this morning, you will have a polluted ash. And you should remember one thing, that incineration is not the same as burning. Incineration is when you have above 1,000 centigrades. If you just burn it in a fire, you have 600 degrees something, and that releases huge amounts of dioxins. And of course, landfill is not a solution. All these toxic chemicals are evaporated. So that's the production and disposal. And you can see, as I said, there's a lot of really toxic chemicals like lead, cadmium, dioxins, whatever. So don't recycle PVC, because then you recycle these toxic chemicals. And in particular, don't recycle it together with other polymers, because then you contaminate the other polymers. So recycling of PVC is a problem. Okay, now we know that production of PVC is problematic. Then we have the use of the PVC. As I said, it degrades over time. These additives leaks from PVC. And the endocrine disruptive plasticizers, they are in focus. This was the wake-up call in our region. These small houses or tubings, they were very nice and flexible when I put it into the small children, but they were stiff when they removed them. And okay, the plasticizer are now in this small body. And as we heard, it is even a small dose of these endocrine disruptors can cause harm in the future. One of these plasticizers, which you should try to remember, DEHP. It's kind of the worst one. It makes PVC flexible, and it leaks when it's used in PVC. And we produce around 2 million tons worldwide, and it is an endocrine disruptor. It can give some respiratory, what would you call it? Never mind. Neuronal and the liver cardiac effects, and also problems with reproduction. What is interesting is that it has been forbidden in toys since 27, but it's still allowed in neonatal care. That's strange. And if we take that little duck, you can read in, I shall not say in the ass, but in the tail of the duck. What is it saying? No. You just read on the. Turn it around. No, turn it around. In the tail, yes. Dinge, yes. Okay, they have substituted DHP probably to dinge. Okay, is that a safe toy then? That's because dinge, is not an endocrine disruptor, but there are health problems with that as well. So that's one thing they try to do. The plastic industry, we know about the dangerous plasticizer. We changed to another plasticizer. But still, the production is the same, and dinge is not as investigated as DHHP. So sometimes you can substitute to something that we don't know much about yet. And this is something I really want you to think about. Don't use old plastic toys. This one has a haircut like Elvis Presley. That makes me nervous. Maybe it's new, I don't know. We actually had a problem in our hospitals that the healthcare people, they brought old toys to the waiting room for the children. And that was a good thing, okay, instead of throwing them away. But we found lots of these strange old toys. So today it's forbidden, and now we actually procure toys. So if you work in a hospital, check out what's in your waiting room for the small children. Sorry, this is in Swedish. We look at the plastic flows in hospitals, and we found 3 fractions that were outstanding. And that was single-use hazardous waste bins, single-use aprons, and single-use medical gloves. First thing is make sure that none of these are made of PVC. So what to do? As we heard, try to reduce the amount of plastic, of course. Avoid unnecessary plastic, obvious. Identify where you have PVC. And is it possible to eliminate PVC from the plastic flow? And also ask for plastic-free packaging. We have a Nordic packaging criteria. If you do procurement, check that out, because it's newly updated in August this year. You can get good recommendations on how to set up criteria for packaging. We have 2 tools for this. One is procurement, and one is behavioral change. We changed by procurement from PVC to nitrile gloves. How many of you are working in a hospital? Some of you. I always have gloves in my jacket. Do you know the difference between vinyl gloves and PVC gloves? You can send them around. It was not that difficult to change from PVC to vinyl, despite that they were more expensive, because the PVC gloves were not very useful. It's kind of permeable to chemicals. And if you use PVC gloves in an ambulance and it's cold outside, the gloves get stiff like this. And they are not as comfortable as nitrile gloves. So despite that they were a bit more expensive, we were able to change. And after a while, the price for the nitrile gloves were actually lower. Good. What's the problem with nitrile gloves then? There is one problem. It can cause allergy. So if you have nitrile gloves, make sure that if people get problems with eczema on their hands, send them to the hospital and test if it's related to the gloves. Quite recently, we have bought accelerator-free nitrile gloves, because it's the accelerator that gives the allergy. So that's the heads up regarding nitrile gloves. And as we're going to hear, use gloves only when recommended. We have a terrible overuse of gloves. Then what we try to focus on is PVC-free invasive plastic. What I used to say, invasive plastic is plastic that you put into your body, or where something has passed when it's going into the body. Could like pharmaceuticals, could be nutrition or whatever. Make sure that is PVC free if it's possible. We made procurement efforts back in 2017, and we managed to purchase 1,400 kilometers of PVC-free tubes or hoses like this. But that was not the end of the story. We have to make sure that we keep that level. So we have to be really careful that we don't buy the PVC material again. And another thing that was a bit surprising was that even if the suppliers said, this is PVC free, and we send it for test, it was still PVC. So there could be problems there. And the PVC-free alternatives then, there are several, we should not go into the details, but there are alternatives. Again, the PVC-free alternatives are more expensive. But the price and the cost is not the same thing. And that's something we used to say. If you buy very nice, cheap PVC medical devices like this, and that baby will have problems in the future because it was exposed to these chemicals when it was a small, premature children, then the cost is quite high. The problem is that it's impossible to correlate that. Okay, the problem with this person is related to DHHP when it was in neonatal care. But we have to convince the management of the hospital, the procurement organization, the politicians, that we have to find PVC-free alternatives. And I used to say that, okay, if you ask the politicians to say, okay, is it okay to expose these children for these chemicals when we know that there are PVC-free alternatives on the market? They are more expensive, but they are on the market. Is it okay? It's hard to answer that question. So it's not enough to say, okay, we have to stick to the cheapest things, even if we have to save money. As I said, the neonatal care is really exposed to these toxic chemicals. And again, if we think that, okay, we have problems here, but we have to mind the production of the PVC as well, not just the exposure. I don't know how much time do I have. Okay, just a few words of PVC-free blood bag. That was a project in Healthcare some years ago. There's a really, I should not say funny thing, but PVC in blood bag is actually, I should not say a good thing, but the DEHP, the worst plasticizer, is used in blood bags. And this plasticizer is stabilizing the red blood cells. So if you use that DHAP PVC blood bags, you can store the blood for a longer time. So there is a project that we're trying to replace the PVC blood bags to PVC-free blood bags and still be able to store the blood for a longer time. It's difficult. I think it's going to be a solution. Maybe you don't have to store all bloods, all different kind of bloods, for such a long time. When we buy our medical equipment, we can actually see when we purchase them if they are PVC-free or not. But how to get more PVC-free products then? Volume and competition gives a lower price. That's the rule of the market. And I used to say network with others. Don't sit at home alone in your hospital and try to solve this problem. Harmonize procurement criteria and dialogue with suppliers. Do you have PVC-free alternatives? What's the price? And let us speak with one strong voice to the market. We want PVC-free medical devices. And then maybe the market thinks that, okay, there's a volume around the corner. That's something we did in Sweden some years ago. We started something called the National Substitution Group, because we were sitting all by ourselves trying to make procurement, and then we start working together saying the same thing. So I can just give you some advice to follow the Reduce Plastic project in Healthcare at Home. We have a new, really interesting project. It doesn't have a name yet, Ariana. Or we call it the first 1,000 days. It's actually a project where we want to minimize the exposure for toxic chemicals for children on the first 1,000 days. And these days are start even before they are born, so we include the pregnant mother. And if you're not in the GGH network, you should definitely look into that. And we also have this European phase-out list. You can find it on Healthcare at Home's website. And there's a list of chemicals we don't want in healthcare. And of course, PVC is there. Because this is something we want to do. We want to push the market to a higher environmental performance in future, and we cannot do that alone. We have to do it together. So like this national substitution group, Sweden is a small country, but if we work together, try to harmonize our criteria, we can make a difference. And I think it's important to have awareness about the problems we have with PVC and toxic chemicals. Sometimes we realized one of the barriers was actually to speak to the procurement people, because they said, I'm a procurement officer, I don't know what a plasticizer is. I can't even spell phthalates. So they need some kind of expertise, like you can mention the problems. And also, then we need politicians or a policy or something says we have to move away from the toxic chemicals. So that's how we can work together. So by saying that, ski time's around the corner, and thank you.
Thank you. Thanks so much. I want to maybe ask the audience if they have questions, but actually I also have a question myself, or also a comment, that the European Commission, like DHP was supposed to be banned from the use in medical devices, but the European Commission decided just very recently to extend that date to allow it to be used in medical devices for longer, until 2029 at least. So what is your opinion on that?
Oh, crap. No, that was really disappointing, actually. So the HCWH is still there for the small premature children. And, well, I don't know. I think the only way we can do is to ask for at least DEHP-free products, especially for small children.
And is the situation similar to bisphenol? Like if a product says DHP free, maybe it might contain other phthalates?
Yeah, okay, that's the problem, because you can make this regressible substitution. You substitute to something else that you don't know as much about. So it's critical. But if we move away from PVC, then
maybe, okay, I see that there are some hands raised, so maybe I can start there and then come to that.
I wanted to know about the fake PVC-free options that you mentioned. You sent it for testing and then you found out that it was actually PVC. How can we spot it if we don't have access to testing? Is there any way?
I think maybe we can share that kind of information. I don't know. Sometimes it could be confidential. I don't know. I can check it out actually. If there are some products, because it's kind of expensive to send items for testing. But I mean, if we test each of us with different kind of products, maybe we can summarize it. Well, I check it out.
Yes, Anders, would you be willing to share the list of
Yeah. It will be in Swedish. For you, it's fine. But I can just say one thing about procurement. We have now, for some time, worked with this sharing our criteria, and that's nice. But now we realized we have to share also the experiences, the outcome of the procurement. So if I had put some criteria in my procurement and it was totally useless, it should not be repeated by somebody else. So now we try to summarize also the outcome. So we have regular meetings in this substitution group. Yeah, I'm not an expert either on all these polymers, but I can say that most of these polymers are much better than PVC, especially if you look at the production of PVC. And because the production of PVC, sometimes it's easy to forget because it's not here. It's over there somewhere in China. Actually, people are dying from it there. I think you have to look at what kind of medical device focused on, what kind of substitutes are there, polypropylene or silicone or whatever. So I think it's a bit more complicated, but it's better than PVC. That's for sure.
Wait, okay. If I can add, also I think Dorota mentioned it in her presentation that PVC is the plastic that uses the most additives compared to its total weight. So that's also.
Well, it's still single-use plastic. So, I mean, it's not a solution, of course. Okay, you cannot always want to recycle things, not reusable things. You cannot replace all plastic items with reusables. I think we're not there yet. So I should say that it's much better. It's not a final solution. It's still single-use. But then I don't know if I have time for that.
Yeah, you can.
Okay. We have one project around aprons, single-use aprons. And we have a collaboration with a company who is actually taking, they produce the aprons, we use them, and segregate them separately. Should not be contaminated with gloves and other things. And then they take these aprons back and sterilize it and make new aprons. So these aprons are actually recycled as plastic. So that's better. We cannot have textile aprons. Aprons is not possible, but that's at least one step ahead. And also, I can mention another one. We have another project with this waste bins made of plastic. Now we have a collaboration with a company in Sweden making these bins of, it's actually made not of wood, but if you, what do you call it, sawmill. What do you call it? When you saw, you have this. What? Sawdust, yes, thanks. It's made of sawdust. So it's not plastic, it's sawdust. It's wood, basically. And so they are sent to incineration. And it's better than incinerate plastic. The main issue with these new wooden bins is that they smell wood. And in some wards, they say, oh, it's so nice. It feels like walking in wood. And if it goes to another ward, they say, it smells terrible. We cannot work in here. It's terrible. So we'll see what's going to happen. I know that in NHS, they have, I think they're made of metal, and they actually reuse them. So there are solutions for removing from plastics from these waste bins. But yes, Yeah, but then you have a whole system for that, all these logistics. Aha. Yeah, when you produce a nitride glove, it's actually a liquid, and there's a ceramic hand dipped in this liquid, and that is polymerized into a glove. And to make that chemical reaction, they have these called accelerators. Different names on them, and some of them are really allergenic. So you have to make sure that if you have other problems with your hand, go to the occupational health service, and they can test to see if it's related to one of these accelerators. We have some of these accelerators are banned in our region. We said we never buy gloves containing these accelerators, and we try to push the markets now to give us accelerator-free gloves. It's a bit tricky. Sometimes they feel that they are not as flexible as the one with accelerators, but there are different levels on these accelerators. Some accelerators are more tolerable by people. But I can give you the details if you want to know. That's in our procurement criteria.